Welcome to dBrief. Hi, this is Rashika and I'm your host for the day. I will be taking you through the highlights of the webinar on a very vital topic, oncology. This was organized by DG Shield in association with IME Mumbai, IME CGP Mumbai sub-faculty on 11th October 2020. Based on recent research, studies show tests that analyze tumor DNA in blood may help detect cancer early, guide precision cancer treatment, and track cancer. The greatest fear for cancer, also known as cancer phobia, is a common phobia and an anxiety disorder characterized by the chronic fear of developing cancer. It can manifest in tremendous feelings of sadness, fear, panic, and distress. To address such problem and to provide awareness, DG Shield joined hands with IME Mumbai to have an interactive discussion and an insightful webinar. The session was kick-started by Dr. B.C. Kalmat, who is an interventional cardiologist in Jupiter Hospital, started to address his chosen topic, 12 Phases of TCOS. He suggested that the TCOS is an extensive trial and that all the cohorts are not the same. In fact, there are unique things about TCOS. He warned about the impact of races on glycemic control along with the risk factors which can turn fatal. To understand TCOS a little better, let's dive into the video.
TCOS is about the safety of sitagliptin and beyond. What we learned today, friends, is more about sitagliptin safety. Old age, CVD safety is very much there. Whatever the patients already having CVD and cardiovascular as well as chronic kidney disease, it is very safe, very safe. Effect of sitagliptin on kidney function and effect of CKD, no deleterious effects, no worsening of kidney function, great. You can use up to the GFR levels of 30. Safety of sitagliptin in patients with heart failure, very much beautiful, unlike saxagliptin and alogliptin, no red marks for heart failure. Hypoglycemia, very small, no severe hypoglycemia. Progression of glucose lowering diabetes therapy still persistent after 3, 4, 5, 7, 8 years, very important. Causes of death observed in patients' history of CVD are equipoise, not more. Impact on blood pressure, good. Pancreatic safety, very well seen. No higher marks of pancreatitis. Racial difference, very much there, good for Asians. Maybe females and men have a different advantage. Both have advantage. And impact of sitagliptin on all-cause hospitalization is wonderful, saying that it's a great, great drug with all the possible good effects on a sitagliptin. If you ask an ideal gliptin, it should be sitagliptin with a very close run by linagliptin. I would say sitagliptin has a huge data.
Dr. Prabha Yadav, who is a director in plastic and reconstructive surgery at Sir H.N. Reliance Foundation Hospital and Research Center, began her lucid speech on the topic breast reconstruction following cancer surgery. She outlined the facts of breast cancer and tried to normalize the stigma by suggesting ways which can lead to cure from the disease. She laid down the different options of breast reconstruction, starting from implant to a combination of both implant with patient's own body tissue. Let's understand what she has to suggest about breast reconstruction.
So, breast reconstruction and oncoplasty are safe. I mean, the fear that recurrence is there, whether you will be able to detect the recurrence behind. The reconstruction does not come in way of detecting recurrence. With the newer modality of imaging, MRI and mammography, it is always possible to detect recurrence. And anytime a patient comes, whenever she makes the first visit, I think patient should be involved in the decision making from the start. And there has to be good coordination between the oncosurgeon and a reconstructive surgeon, and patient should be involved in the decision making from beginning, because they do need some time to think over. You just cannot say we do reconstruction, this is there, and take the patient next. They need some time to digest that information and come to the conclusion. Now, previously it was not covered under insurance, but breast reconstruction, if it's done simultaneously along with the cancer surgery, it is covered under insurance. And we have always seen that patients who have undergone reconstruction are very happy and satisfied. Patients should be educated that it is possible to do reconstruction even after many years. We had one patient whom we did reconstruction after 10 years, and then she was so happy that she used on her own used to counsel patients that get a reconstruction done, and that used to many times convince the patient that there is no morbidity, there is no problem, we can undergo reconstruction. So every woman undergoing surgery for breast cancer has a right to be informed and right to have a best possible reconstruction available and a free will to choose from. It is the primary treating doctors, I think I should say that's the responsibility to educate the patient about the reconstruction. No decision is right or wrong. Patient doesn't want a reconstruction, that also is right, and patient doesn't want reconstruction, that also is right, because it is a purely cosmetic procedure. How the lady gives importance to her body image, it depends, changes from person to person. But it should be an informed decision, not a forced decision or not an any ignorance taken decision. I think each lady deserves it, and no lady should be reminded every day looking at her. You can give her, we gave them all option from reconstruction to no reconstruction at all. Patient can use an brassiere with an mold inside, and once they wear the cloth, you can't make out whether the breast has been removed or not. It is for patient's own satisfaction that it will be there. But now in today's era of tissue engineering everything and lipofilling and liposuction, maybe the thing is moving towards an tissue engineered breast or only lipofilling is possible.
Up next, we have Dr. Preetham Kumar Jain, who is a medical oncologist and hematologist, started to address the topic Updates in Oncology Breast Cancer Management. He started by sharing an alarming fact regarding the statistics of India, where every 1 in 22 women has breast cancer. He suggests that even if the ratio in India is low as compared to the US, but the mortality rate is exceptionally high. Early detection is the key to win over the disease. He concluded in a good way by suggesting some tips. Let's just hear what they are.
So summary here, we are witnessing breast cancer in a much younger ages than earlier because of the risk factors that are prevailing in the modern lifestyle. The numbers of breast cancer cases in all the age groups is rising rapidly. More than half of the patients still present to the doctors in advanced stages. Unfortunate, but this is the reality. Breast cancers in the young tends to be more aggressive. Please don't be of the notion because she's young, so she will recover. No, the younger breast cancers are more aggressive than the older population, and the survival in younger patients, especially in advanced stages, is less. So ensure that a young woman who has just become a mother, who has kids, she needs a good family attention. So I believe every husband should give a gift to their wives on the day of their anniversary. Please take her for mammography screening after the 40 years of age. That's the best gift that you can give.
Nikhilesh Borkar, who is an oncosurgeon in Sir H.N. Reliance Foundation Hospital and Research Center, began to speak on the topic Anatomy of Thyroid. He started by explaining the functionality of the thyroid glands along with the symptoms. He explained the cases in detail along with the diagnostic procedures. He provides some take home messages. Let's just know what they are.
So the take-home message is thyroid nodules generally do not cause symptoms. Thyroid tests are most typically normal even when cancer is present in the nodule. Best way to find a thyroid nodule is to make sure you check the patient's neck and do an ultrasound if needed, and don't forget the TSH level. The overall prognosis of differentiated thyroid cancer is excellent, even especially in those less than 55 years. For older than 55 years or those with larger aggressive tumors, prognosis still remains good, but the recurrence risk is higher. Advanced cancer, if they cannot be completely removed or destroyed with radioactive iodine treatment, prognosis is not good, but nonetheless, these patients continue to live for a long time, despite the fact that they have like a chronic disease like diabetes or hypertension rather than curing it completely.
Mr. Sanket Barale, who is currently directing DigiShield, put forward how DigiShield can effectively screen the COVID-19 carrier patients before they can visit the clinic and enable the doctors to practice securely in these challenging times of COVID-19. DigiShield can conduct a quick and effective COVID-19 carrier risk screening of every patient before visiting clinics. You can log on for more information about DigiShield on www.dgshield.me. To view the complete webinar, click on the dBrief menu. For now, this is Rashika signing off till next time. Stay safe, stay strong.